I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System located in Thibodaux, Louisiana, a few miles from the Gulf of Mexico, about an hour from downtown New Orleans. At Thibodaux Regional, which is a 200-bed hospital, we've become a regional medical center, the heart program, cancer program, neurosurgery program, and so forth. Over the years, we've experienced a lot of natural disasters such as floods, hurricanes, tornadoes, windstorms, and so forth. So the principles around managing, leading during those phenomenon, we think, apply to the pandemic. So I'd like to share with you for a few minutes, the actions that we took as the COVID very quickly came upon us. First of all, we executed our plan. About every hospital, I think, has a disaster plan of some sort. And we had taken that plan and worked on it very diligently to adapt it to the COVID-19 circumstances, most of which we didn't really know what was going to happen. And so we knew we had to be flexible. We knew we had to really stay focused. We knew we had to engage our whole organization. And we had to follow the regulatory guidelines and directives given to us by the governor and others. We're in constant discussions with the regions designed by the state throughout Louisiana, and these conversations were amazing. Sometimes it would be something like this. We need you to add 50 more beds in your wellness center. They're all ICU capable. Go figure out how to get those beds and the ventilators and so forth there and provide that care. So it was taking kind of sky-high, unclear expectations, and everybody sort of grappling with that down to what do we do today. And so we put them in various categories according to our plan. One was PPE equipment, of course, and it's very difficult to get a lot of that equipment. I'm happy to say that we were able to. We never ran out of it. Our supply guys worked very effectively with the vendors, and that resulted in us being able to get enough to stay ahead of the game and be able to be successful in providing protective equipment for our staff, visitors, doctors, and so forth. I'm very proud of them for the outstanding job they did in that regard. In addition, there was equipment. Ventilators on the front end were a high priority. We had 30 to 40 ventilators, and it was how many more can you get? And then that was all taken over by the government. And as far as the facility was concerned, we filled up our intensive care unit, step-down unit, and other areas very quickly. I came on a Sunday morning. We took our maintenance crew and established a whole floor for COVID early in the process. At the maximum, we had 60 COVID patients, and many of them were very sick. We converted the facilities so there was negative air pressure. We made a lot of other changes that enabled us, I think, to manage that patient population very, very well. In addition, we had to close down a lot of things. We have a wellness center that has 350,000 visits a year to it, and overnight we closed it. So what to do with the staff and reallocating them and being able to use their skills and abilities in a different way than they have been was important. Surgery closed down, and so on and so forth. And that was challenging and an opportunity for us in some ways. Kind of shook up our organization a little bit and helped us all understand we need to be flexible. We need to be able to work where the work needs to be done, not just in our old way of doing things. Help us appreciate other departments and how they work and how the two work together. We formed a group of doctors led by an infectious disease guy, Paul Monnier. But Dr. Monnier was aided by critical care specialists, other physicians that were engaged in it that we put on this team. And they really did a great job of working closely with our staff and with the other physicians. We spent a lot of time communicating to our physicians what we were doing and going out and acquiring the latest and greatest information about treatment for COVID patients. We'd like you to hear some comments from Dr. Paul Monnier, infectious disease specialist at Thibodeau Regional.
I'm Dr. Paul Monnier. I'm an infectious disease physician at Thibodeau Regional Medical Center. When COVID-19 came to our facility, we recognized that we needed to put a team together to help with the clinical approaches to this disease process. So with myself and our hospital medicine specialists, our pulmonary critical care doctors, ER doctors, our lead clinical pharmacist, we got together and basically looked to see what was being done at other places that had experience with this disease process already. So we looked at places like Washington State, New York, and so forth, took information from those places, reached out to our colleagues at other facilities that were dealing with the disease at the same time, and then took all of that information, reviewed whatever literature was out there, and basically took that and incorporated into something that we thought would be individualized for our facility. In doing so, I believe we were able to put together a set of treatment guidelines that made a lot of sense based on the information that was available at that time and helped us to deal with these patients successfully. So during the course of treating these patients with COVID-19, one thing that became apparent was that in some of the complications of this disease process, it was best not to venture too far away from evidence-based practices. There was a lot of information out there, some of it good, some of it not so good, and some of it led us away, or led the medical community away from using more evidence-based practices. And at some point we said, do what you know how to do. So for instance, patients with respiratory failure, it was best to treat those patients with the same evidence-based principles that we would normally approach them with. And I think that helped us to have better treatment outcomes and helped us with managing these patients through the system so we didn't get bogged down and so forth. In some ways, we were at a disadvantage because we were really at the doorstep of one of the early hotspots with COVID-19. So we did not have the advantage of having months and months to prepare for this. Anybody who's involved with process improvement understands that one of the key principles of that is being able to pivot and to be agile and to be able to change rapidly. And I believe we were able to do that using a lot of the principles that we already employ at Thibodeau Regional Medical Center.
So we had 60 COVID patients at the peak. We're a 200-bed hospital. So, it was a lot. Very sick people, very challenging, difficult, a lot of unknowns, and required a lot of adaptability. But I want to share with you a few of the things that we did in addition to what I stated earlier. One was that we contracted with a group of specialists out of New York who had previous experience with COVID, and the way we brought them in was tele-ICU. So they acted as a support, a 24/7 hour resource for our physicians to give them a little bit of rest when they needed it, and also to bring their expertise to the table in these really the ICU type of patients. That was a great thing there. In addition, we did a thing that was a little more far-reaching, but very, very, very good, and that was we worked with the Mayo Clinic. We actually entered into a venture with them to do research regarding blood plasma treatment. In addition, we entered into agreement with General Electric Corporation around data and analytics and being able to use the artificial intelligence to predict and monitor and otherwise treat COVID patients. Those were innovative things that occurred that were very encouraging. In addition, we had our ICU and step-down unit, and I guess I was the one that asked the question, why do we need an ICU and a step-down unit? Because we had a lot of pressure on us to provide care to a way larger number of people than we had ICU beds and step-down beds. And so it's something that I thought of a number of times in years past, but here it came to a focal point. And the government folks were really asking a lot of hard questions about where to put these patients in civic centers, in our wellness center, in many different places that were, to me, less desirable, very much less desirable in terms of the quality of care, the ability to staff some remote location, the technology and all aspects of the care, the processes and so forth. So we had a floor that was not finished out. And we brought the architects in and a builder who's building our cancer center. We're building a $50 million cancer center right now. And we sat down, and it was 2 days over a weekend and designed the build out of that floor, and were able to complete it within 45 days. That gave us 30 additional critical care beds. Everything in there is new, state-of-the-art, very beautiful, gives us way more capability in that sense than we had before, and it changes the model. Adaptable care units, whatever you want to call them, I'm not sure how many of them are in the country. There are some, I'm sure, but in this area there aren't any. And it's innovative, and I feel like we can get better quality, better outcomes, we'll be more productive, and those things allow us to do a lot of other stuff. So those were a few steps we took with services and with facilities at Thibodeau Regional in order to address the COVID emergency. We employ about 1,300 or 1,400 employees. We have 250 doctors on our staff. And first of all was the concept of teamwork, working together. I thought that the teamwork was exemplary. The way problems were solved, the way unknown things were discussed, and then an action plan developed each day in the middle of the night in small groups, in larger groups. The way they took our plan and executed it was really, really commendable. So thankful for that. So we saw people who were doing jobs that they hadn't done before, they were concerned about the unknown. They weren't acting foolishly, but they stayed very focused on what their skills and abilities brought to the table. When they were put on a team that they don't normally work on, they worked very effectively with that team and were very agile and adaptable. That to me is a winning characteristic when you're dealing with a hurricane, a tornado, a natural disaster, any kind of pandemic or other significantly sized thing that can occur in your community, in your region. We did a lot of reward and recognition. They were little things, but we did a lot of them each day. We orchestrated them. We made sure they happened. We wanted people to know how much we appreciated their work in little ways and big ways. We instituted a lot of heavy-duty communication through all the sources that we could command, where we communicated directly to the staff. This is what's happening. This is what steps we're taking to address the issues that are before us today. We've been successful at this. We need to keep doing this, and so on and so forth. The community was amazing. You know, we try hard in 100 different ways to serve the community that we live in. Here the community gave an outpouring to us. That was inspiring. Where each day as we'd show up at work, something would arrive. Truckloads of things, cards, little notes about prayers, people driving around our hospital praying, and so on. So many different ways that the community inspired our staff and thanked them for what they were doing. That was inspiring to me. And the story goes on, but let me just say that even in the most difficult times when people work together as a team, and the culture has prepared them for these kind of things, and they have a confidence and a resilience, and each person considers himself a leader, and they work out of courage and not fear, that you have a chance to do a really great job. At Thibodeau Regional, I feel like we've done a great job. Thank you.